Neil 64 is from Norfolk, ex-serviceman. He's got itchy, dry skin, inflammation, redness and serious depigmentation. He suffered a reaction to some cleaning fluid. Neil went to the hospital with contact dermatitis on his hands. Contact dermatitis is a form of eczema. The military doctors thought it could have been triggered by an allergic reaction to traces of formaldehyde in the cleaning products. They gave him steroid cream to treat the rash, but Neil couldn't keep it under control. Consent scratching has created a widespread infection. He was recently in the hospital. Neil suffered from immune response known as sepsis when the body overreacts to infection. Untreated, it can kill in days. He does not socialize any longer. Dr. Wong says the very top layer of the skin, the epidermis, he has removed. Wong says eczema is the name for a range of conditions. Professor John T-cell lymphoma or other types of cutaneous lymphoma. Michael the presenter says the cancer of the white cells. Blood cancer could cause itching. Dr. Wong noticed he had kidney cancer last year. This is called perineoplastic rashes. Neil recently had a tumor removed from his kidney. He took a lot of medication prescriptions that last him up to 6 months on his road trip to see the Dr. Wong in London. She will first consider the theory that Neil's task developed from an outbreak of eczema on his hand, after a reaction to cleaning products. He was told not to use any fragrance or deodorants. Wong examined his skin to see what could be the issue. He was given steroid cream. It has become quite thick and hard. Why is he not responding to the treatment? Wong will give him a new course of steroid cream and strong steroid tablets. In the meantime she will look at another outcome like an option put forward by the team is hematologist, which needs urgent investigation. For example, underlying cancer, a blood cancer, for example. Dr. Wong ordered a blood test and skin biopsy. It will be to the lab for analysis. Joining Dr. Wong to make this crucial call regarding the blood test is leading urologist Tet Yap and top blood cancer expert John Gribben. John says the blood count is elevated, but the picture of the elevation is much more in keeping with somebody fighting an infection. Wong expresses that his biopsy result shows he has not got T-cell lymphoma, and John agreed with her. The process of elimination means blood cancer is not there anymore. Now they focus on cancerous tumors already removed from Neil's right kidney. Wong worries about renal cell cancer, kidney cancer history, some of those cancer cells that can cause skin problems, and Tet says we need to a CT scan first to check it to understand the risk of recurrence. Neil kidney cancer completely cleared, which is very good news. Wong examined the patient to check whether the medication was working or not, to reduce the itchy in the skin. There were positive signs that the treatment was working. Open areas have healed over. Now for the next step, which is chronic eczema. Katie, 35, has multiple things going on: pains in the stomach, muscles and irregular heart rate. Just getting up and walking across the room, it can spike at 140 beats per minute, also having excruciating stomach pain. Plus lost a lot of very quick weight loss. Katie on antibiotics, codeine, paracetamol. She ended up having a variety of feeding tubes to help her eat. Dr. Stephanie looking at possibly Ehlers-Danlos syndrome, so you get very lax connective tissue and it can affect places such as the gut, the musculotendinous attachments and also the heart. Dr. BOON, the Ehlers-Danlos syndrome creates a very compliant set of blood vessels, so they could accommodate more fluid. Dr. A affects the compliance or the elasticity of the blood vessels. It also affects the lining of the gut. Dr. Barbara says she has symptoms of tachycardia, which is the fast heart rate, with headache, palpitations. Can suggest the possibility of a tumor of the adrenal glands. She also spoke about the rare syndrome called multiple endocrine neoplasia, which stands for men where patients have tumors in the glands that secrete hormones. Stephanie specialisms in conditions that cause pain throughout the body. Ehlers-Danlos syndrome is why Katie's stomach isn't emptying. She dislocated the tip of her coccyx, but that was in childbirth, which is very important. Stephanie examined Katie and she also talked about hypermobility. That's a sign that the collagen in the connective tissue, the tissue that binds us, is faulty, too elastic and stretchy. Stephanie says the stomach, the gut wall became too elastic, therefore, the food there doesn't move into the small bowel. She checked if she had it. However, there was no test to be 100% sure. Barbara, endocrinologist, is worried that Katie's heart problems could point to another serious condition. She practices endocrinology, which is the specialty to do with hormones. Hormones are chemical messages that circulate around the body, but sometimes our glands make either too much or too little of these hormones. The balance is crucial to our everyday function. She excludes the possibility of multiple endocrine neoplasias, so she is doing her job well. She wants to check up the surgery that Katie had on her neck years ago. They took out the 3 glands and left one. Barbara says this is quite unusual. In the neck, we each have 4 parathyroid glands which produce the hormones that regulate calcium levels. Barbara took a picture of her chickenpox scar. Benign skin lesions called collagenomas are a possible sign of me. The results were negative. To find out, she sent out a blood sample. If she had it, could pass it on to the children. Stephanie got the results to check whether she had Ehlers-Danlos syndrome. She explained to Katie what it is and that she has it. With the results, it all fits together. This means her and the family will need to check for the same thing. There is no cure but a clear diagnosis. Hopefully her weight can come to normal with the diagnosis.